everyone. My name is Dr. Gresham, and Belinda Leung has joined me today. Today we are at Studio Skin Sculpt, and we are talking about how this amazing business came to be, about Medi-Spa and aesthetics. I got really excited to learn more from Belinda because I exist in hippie worlds and have all these misconceptions about different aesthetic procedures, and as I've gotten to know Belinda and call her a friend, I really had my mind blown about it's not what I thought it was. And so can you tell me a little bit more about how you got into this line of work?
Absolutely, because I think it's a fun story. My neighbor and I were having dinner, and I was just about to look into purchasing another business. I'm an entrepreneur and have been for over 2 decades, and I love owning businesses. And over dinner, she said to me, Belinda, I've got this mentor who is in the aesthetics world, and they just couldn't keep enough body sculpting machines in-house because they just had lines out the door. And so when we heard about this, I didn't know you could destroy fat cells on your arms and on your back and on your butt. I was like, well, who doesn't have some kind of fat that they want to get rid of, right?
Exactly.
So we thought, oh, okay, well, we're going to look into this. And as we did our research, we realized that we should have a medical spa with the whole suite of services, including injectables as well as body contouring. And my business partner and neighbor is a nurse, and so it seemed to fit, right? I could do the business and marketing side, and she could do the treatments on the nursing side. So that's how Studio Skin Sculpt came about.
Wonderful. So it's like a neighborhood family-run kind of shindig.
Absolutely.
That's awesome. Who doesn't love supporting a little family-run thing? So I guess my first question for you is, who do you think would benefit from getting Botox and fillers? And can you tell us a little bit more about them?
Yes. So I'm an advocate of educating people about what treatments are, like Botox and filler. And oftentimes people, you get this very disparate reaction. Either people love it, they're like, yeah, I'm super into Botox and fillers and injectables, or they're like, ooh, I would never do that. So, our philosophy here is that we just want to tell you what they are and what they can do. So Botox and fillers are, although they're kind of bucketed in the same thing as injectables, they are very different treatments. Botox, as well as there are several other neuromodulators, that's what we call them, neuromodulators, that are available in the US. Botox is the brand name. So Botox, if you look at my face, I'm going to make faces. I raise my brows, I smile, I furrow. All the expressions that I just made on my face can be softened with Botox or a neuromodulator. Filler, and I'll back up a little bit. Botox, so all of those things that I just did on my face are dynamic wrinkles. See? Crow's feet, furrow. Those things that you can see when I express are dynamic wrinkles. If I hold my face still like this, you see these little lines here. Those types of folds or wrinkles can be treated with filler. Filler is something that doesn't stop a wrinkle from happening. What it does is it helps restore volume. So oftentimes as we age, we lose volume in our face and fat pads separate. And because of gravity, we start to kind of sag this way. And everyone loses volume in different places. Oftentimes, it's very typical for someone to lose volume here in their temples and also here. And so I know maybe many of us have been caught in the mirror doing this to ourselves. Wow, my face would look so great if I could do this to it. Gosh, that sagging's gone. See, my jawline looks better. So that's what filler can do. Filler can help restore that lost volume if it's put in the right place. And so that's kind of the difference between Botox, softening a dynamic wrinkle, and filler, which is something that can help restore volume or plump a pout, like plumping lips.
Definitely.
So that's kind of 2 differences.
That was really helpful. I didn't necessarily know the difference. So.
Yeah, people come in and say, can you put, they mix them up.
Yeah. What about, how much does it hurt?
So I'm not gonna lie, it is an injection. It's a needle for both of those. That's why we call them injectables. Botox is administered with a very small needle, and it's pretty much it's not a deep injection, and so it does feel like what a lot of people compare it to a bee sting. And it's very quick, probably a little tingly. Filler, there's a couple. Filler can be injected very deeply, or it could be injected kind of almost at the surface of the skin. So depending on where you have it done, it's going to be, it's an injection. But here at our medical spa, we use medical grade topical numbing. So that's number one, to make it as comfortable as possible. And if someone's getting filler in their lips, which is a very vascular, very sensitive area, our aesthetic nurse really likes to use dental block to make it as comfortable as possible. So, yes, you're gonna feel it.
Okay.
Hopefully not for very long.
What about like the downtime? Like after you get the procedure, how soon are you back to your regular activities?
No, that's a great question. A lot of people ask that, especially for first-time clients who've never had any injectables. Botox is what we call a lunchtime treatment because you could come in and it takes longer for you to do your paperwork than it does for the actual injection. And people come in at lunchtime, they get their Botox, and then they go back to work or run errands. Like, it's no downtime at all. You don't want to be doing exercising or lay down for a few hours afterwards, but that's the only real limitation. Filler, I think, is more, there's a science and an art to it, because our aesthetic nurse, Misan, loves to really look and study your face to see where the filler would be best put. And so that's at least an hour-long appointment, especially with topical numbing. And some people, I've seen a lot of people walk out right away and say, oh, I'm just gonna go continue my errands, because no big deal. They have no swelling, no bruising or anything. And so other people just have a lot of bruising, and so they will experience swelling or bruising for the next few days, especially lips. Lips, we recommend people, if you can, go home and just relax, and then ice, and could be swelling and bruising for the next few days.
Well, I mean, good thing we've got lipstick, right?
Yes, lipstick.
I wish I could say that with all the various different injections, like IVs, that I might give somebody a bruise, so it's not always as easy as lipstick.
Yeah.
So, how long do these procedures last, like the effect of them?
Yeah, so Botox typically lasts from 3 to 4 months. So if someone comes in for an injection, it also takes about 3 to 7 days for everything to kick in. So you're not going to walk out of here being, oh, I can still furrow. Yes, that's exactly what will happen. We check in with our patients at day 14, because that's how long it takes for everything to just kind of settle and be in place. The Botox will last about 3 to 4 months. And I always say, unless you have an amazingly fast metabolism. So if you are training for a marathon, if you're a triathlete, if you're in the NBA, you will probably have to call us sooner, like probably in about a month and a half, or depending on how fast you metabolize it. Filler, on the other hand, lasts for, I'll back up a little bit. Filler can come in varying viscosities, like levels of thickness. The really thick fillers on one end will last probably up to 2 years.
Wow.
And then you use softer filler around the mouth in areas that move a lot, malleable. So those last maybe 9 months to a year. So anywhere from 9 months to 2 years.
Wow. So it's like a little bit of lip bruising, but then you're gonna have an effect for 1 to 2 years almost.
Yeah. Well, specific lip filler is pretty soft, so maybe 9 months to a year.
Yeah, still that's longer than I thought you were gonna say.
Okay.
So that was surprising. So
you get your plumped palate for a year.
So where can people learn more and continue the conversation with you?
So we offer free consults here at Studio Skin Sculpt, because we think it's really important that people understand what's available and what the best treatments are that we recommend. So come in for a free consult, talk to our aesthetic nurse. And when you talk to our aesthetic nurse, I always encourage people to bring in their products, like whatever they're using on their face, because if you say say to us, gosh, you know, my biggest concern is pigment or emollients or dryness. And then we look at your product ingredients, and you may be missing that key product that's really going to help treat whatever your concern is.
Wow.
So come in for a free consult, and you walk away with, we put together a personalized roadmap to glowing skin.
So I can come in with my products in my consult and get basically like insider tips about what's working in my product line, what's not. That's just part of my consultation with you.
Absolutely.
Did I understand that correctly?
Yes.
Oh, that's awesome.
Absolutely.
That seems like a good reason to come in, just get pick your brains about that. Yeah, and I also would really encourage the audience seeing the before and after photos, because I think again, the stigma, I've seen a lot of, I think, people getting procedures maybe at less experienced facilities, and that the results look very obvious when you're staring at somebody's face. And just looking at your before and after photos and all of your lovely patients that are coming in here, it's, you know, I don't think I would even know. I would just look at them and say they look fantastic. I don't know what they're doing, but they look fantastic. So that's a good reason to come in as well. So.
Yeah, thank you.
Wonderful.
All right, well, go ahead.
It was wonderful to be here with you. They're certainly available to ask more questions, and I really have found it to be very transformative in my own biases and misunderstandings. So the education, you know, you feel more empowered after you're educated. So yeah, thanks for tuning in.